Hello everyone, it's me Dr. Ayaz Ahmed. I am working as an aesthetic dermatologist. Today I will discuss another important topic of dermatology. The name of topic is arterial vasculitis. Hopefully you will learn and subscribe my YouTube channel. Definition: arterial vasculitis is a rare disease characterized clinically by arterial lesion with histological evidence of leukocytoclastic vasculitis. Clinico-pathological correlation is required for diagnosis. It is also known as the arterial venulitis and MC-Duffy syndrome. Epidemiology: lifetime prevalence is about 0.025%. 1% to 20% of patients present with chronic arterial illness. Arterial vasculitis peak in fourth decades of life, but hypocomplementation arterial vasculitis are abbreviated as HUVD in fifth decades of life. Women are commonly affected. It's a common in white population and Asian population. Association: it is commonly associated with systemic lupus erythematosus and Sjögren's disease. Moreover, hepatitis B and C are frequent association. Serum sickness is an important acute form of arterial vasculitis. Hematological disorders which are associated with arterial vasculitis include ITP, Hodgkin lymphoma, acute myeloid leukemia, and IgA melanoma. Other associations are Schindler syndrome, Muckle-Weill syndrome, and Cogan syndrome. Pathophysiology: the pathophysiological features are circulating immune complex, complement and mast cell activation, pro-inflammatory cytokine production, endothelial cell activation and damage with inflammatory cell infiltration, neutrophil keratiosis, and fibrin depositions are the main pathophysiological features of arterial vasculitis. Post-capillary venules are mainly affected in superficial dermis. Endothelial damage is due to circulating immune complex. Depositions of IgG, IgM, and C3 complement within and around wall and at the dermal epidermal junctions are the main features of disease. Hypocomplementemia in arterial vasculitis is due to complement activation by circulating immune complex. Patients usually have positive IgG antibody that is directed against collagen-like region in C1q and low-level C1q. Antibody involved are ANA, antiphospholipid antibody, and anti-endothelial antibody. Mast cell activation occur early and cause vasculitis lesion, releasing tumor necrotic factor alpha, interleukin 6 and interleukin 1 receptor are increased, leading to swelling and necrosis of endothelial cells. Exercise-induced arterial vasculitis is characterized by eosinophil within 3 hours, followed by neutrophil at 24 hours. Moreover, lymphocytes usually appear after 48 hours. There are two types of arterial vasculitis. Number one is the normocomplementemic arterial vasculitis, or abbreviated as NUV. Another type is the hypocomplementemic arterial vasculitis, or abbreviated as HUV. They both differ primarily in complement level and disease severity. The complement level in NUV has a normal complement. Moreover, HUV is characterized by low complement level, particularly C1q, C3, and C4. Severity and systemic involvement in NUV is generally less severe with minimal systemic symptoms. In contrast, HUV often presents with systemic manifestation such as arthritis, pulmonary issues, and gastrointestinal involvement. Associated symptoms: HUV may include more severe symptoms like fever and joint pain, whereas NUV typically involve skin lesion without significant systemic effect. Pathology of vascular vasculitis. Pathology include types of inflammation. It includes leukocytoclastic vasculitis affecting small blood vessels, particularly post-capillary venule. Vascular change include endothelial swelling, neutrophilic infiltration, and fibrinoid necrosis of vessel wall. Immunofluorescence shows depositions of immunoglobulin, especially IgG and IgM, and complement C3 and C4 along blood vessels and basement membrane zone. Associated symptoms include erythroalgia, abdominal pain, respiratory issues, especially in hypocomplimentic cases. Environmental factors. Certain drugs, especially simtidine, diltiazem, procarbazine, potassium iodide, clozapine, and procainamide and etanercept are involved. Infections such as hepatitis B infection, C infection, and mononucleosis and Lyme disease are other important factors. Rarely, exercise, sun exposure, or cold may aggravate arterial vasculitis. Thank you very much. Stay connected and subscribe my YouTube channel.